Welcome to Michigan Medicine. We are pleased you have chosen us for your care. The purpose of this video is to provide information regarding the procedure that you will have today and to explain the benefits and potential risks of the procedure. We will also describe alternatives to the procedure and provide an opportunity to ask any questions you may have about your procedure today. The procedure you will have today is a flexible sigmoidoscopy. This procedure is where the doctor uses a flexible, narrow tube with a light and tiny camera on one end called a sigmoidoscope or scope to look inside your rectum and lower colon. The lower colon is also called the sigmoid colon and descending colon. Flexible sigmoidoscopy can show irritated or swollen tissue, ulcers, polyps, and cancer. Now, I'd like to discuss the benefits of this procedure with you. With a flexible sigmoidoscopy, doctors can find the cause of symptoms such as bleeding from the anus, changes in bowel activity such as diarrhea, pain in the abdomen, and unexplained weight loss. Doctors also use flexible sigmoidoscopy as a screening tool for colon polyps and colon and rectal cancer. Colon polyps are abnormal tissue growths that may turn into cancer with time. If a polyp is found during the procedure, you may have to have a subsequent colonoscopy to have it removed. Flexible sigmoidoscopy can also find cancers at earlier stages. This greatly improves the chances for treating colorectal cancer successfully and reduces the chance that a person will die from colorectal cancer. It is important that you will know and understand the risks of the procedure. The risks of complications from a flexible sigmoidoscopy are low, but may include a reaction to the sedation medication, including breathing or heart problems, bleeding, which in most cases occurs in patients who have polyps removed. The risk is higher for polyps that are larger than 2 centimeters. Perforation, which is a tear or hole in the wall of the colon or rectum. Aspiration, which is where stomach contents get into the lungs, which may lead to a lung infection, also called pneumonia. And finally, infection, which is rare. Rarely, blood transfusion or surgery are needed to treat these conditions. Risks are higher in patients taking steroids or anticoagulation medications, or in patients that have certain serious diseases. There is also a risk that cancer or polyps will not be detected. Now let's talk about alternatives for a flexible sigmoidoscopy. There are other screening tests such as barium enema, CT scan, or MRI that may detect abnormalities in the colon or rectum, but these procedures do not have the option of taking a sample tissue during the procedure. This reduces the need for additional tests and surgeries. Thank you for your review and understanding of the risks and benefits of flexible sigmoidoscopy. Your doctor can answer any additional questions you may have. Thank you for receiving your care at Michigan Medicine.